Well, hello everyone, and thank you for joining our podcast. My name is Sarah Jackson, and I'm in Inner Health here today to speak with Melitta Basa, who is the Vice President of Clinical Services. And we're going to be talking a little bit about mental health and substance abuse treatment today, specifically around some of those difficult emotions that accompany depression and anxiety. So Melitta, we're excited to hear some of your insights and hear some of the tips on how we can best cope with some of those feelings. And you mentioned a little bit in kind of talking about some of those, dangers and kind of the negative coping mechanisms associated with depression and anxiety. Can you talk a little bit about more in depth, I guess, per se, on kind of how substance abuse and addiction can play a role in exacerbating depression and anxiety? I know that obviously addiction takes many different forms, but it can play a pretty heavy role in both issues.
Absolutely. Was it the chicken or the egg first, right? Is always the question. Was the depression and anxiety presenting prior to the admission to inpatient or outpatient treatment? That takes a long time to really reveal. But initially, when an individual is coming off of the drugs or alcohol, the brain is trying to balance itself out again. So what happens is the brain is kind of feeling like depleted of all the chemicals, right? And so they're going to feel naturally depressed or naturally anxious just because the brain is, not at the level that it typically would be. So naturally they kind of feel that. And then as time goes on throughout recovery, that either can stick or become worse, right? So it either can get better or get worse. And typically, if they're an inpatient type of situation, they will receive medications that will help them. And that doesn't mean it has to be forever, but at least in the beginning. And post-acute withdrawal symptoms, we call it PAWS. That's the brain healing. So when we experience symptoms of irritability, anxiousness, can't sleep, sleeps too much, low energy, all of those are symptoms of depression and anxiety, but also post-acute withdrawal symptoms. So they can experience that up to 18 months. So yes, so that's why, we really encourage additional therapy post-inpatient because they are going to experience that. And life stressors do not go away. It's how do we respond to them? And if we can help them identify, is this a stressor that I can manage, or is this, true depression, and help them kind of navigate that through life while their brain is healing. That's exactly what we're here for.
Absolutely. Wonderful. If you'd like to learn more, you can reach out to the experts at Inner Health by calling 800-388-4601 or visiting innerhealth.com today.